There are so many pieces to the health and social care jigsaw that it can be difficult to see how it all matches and overlaps. But it is possible to put the pieces together and share people's health and social care views with those designing the service they need. And that's what Healthwatch Norfolk works hard to do. In the past year, we've gathered almost 5,300 pieces of feedback experiences through talking to people face to face, answering their inquiries on the phone, and collating the feedback we receive online through our website. Our engagement team's also written and compiled over 40 reports based on the feedback we receive from visits to GP surgeries, care homes, and health and community events. We also received 197 requests for advice in the financial year, and this has meant we've received feedback like this.
It also helps inform our future priorities around the more detailed work to look into. One example of this is the ongoing concerns about access to NHS dental care. We carried out a survey to find out more, receiving over 200 responses. Over 3/4 told us they couldn't get a non-emergency dental appointment, and 48% couldn't get emergency care. People told us their practices had switched to private care, and they had in some cases decided to treat themselves. We recommended better signposting, children and the most vulnerable should be prioritised for care, and this led to our dental summit, where those in charge of dental services in Norfolk, dentists themselves, and the views of patients were debated. We heard some work had been started with more emergency appointments, more dentists employed, and a lot of prevention work going on to educate particularly children, but there's still a lot to do. We also asked Norfolk's LGBTQIA+ community whether they felt their healthcare was affected because of how they identified. A total of 164 people shared their thoughts, with nearly 60% feeling this was a factor. A lot of negative feedback was shared with us, particularly around consideration of sexuality and gender, and it's an area we'll be returning to. NHS Norfolk and Waveney also asked us to find out what the community wanted to happen with one of the buildings at the Benjamin Court complex in Cromer, which has been used for a number of services in the past, including reablement and rehabilitation. Nearly 300 people responded, mainly from North Norfolk, with 79% asking for it to be reopened as it was, while the remaining 21% wanted it to have a use relating to health and care. We were also asked to carry out detailed project work for a number of other organisations. We were asked to continue assessing the work being done to transform community mental health. We found many adults affected by mental illness and their carers are still not getting the help they should, with ongoing concerns about waiting times for help and people just not feeling in control of their care. It wasn't all negative. There was also some positive feedback about rehab, where different organisations and departments have been working together to help those who need it. The needs of carers were also front and centre of another report, this one focusing on those caring for adults with serious mental illness, or an SMI. It was a similar picture there, with just under half of those we spoke to concerned they don't get enough information and their voice isn't heard, as well as not getting enough help with their own health and well-being. There was also a focus on digital ways of getting care, with around 800 people taking part in a year of activity around developing those. We heard there were huge gaps in knowledge and awareness of things like the shared care record, which gives health and care professionals access to information so you don't have to repeat yourself, and also the NHS app. In fact, only around 20% of young people we spoke to said they were using it. We suggested more promotion and information about the app and other digital methods of getting help, and that's a key part of our work in the current financial year. Our engagement team have been really busy too. As well as their engagement work and compiling reports, they've also targeted care homes and visited a number to talk to residents, their families and staff to understand their experiences and also to share good practice. They've also ensured a Healthwatch Norfolk presence at the Crucial Crew events held around the county for Year 6 pupils. They've delivered workshops to over 4,000 children so far and also gathered their feedback around health and care. And across the year, they've carried out more than 260 face-to-face engagement visits, talking to people and gathering their views too.
Healthwatch Norfolk's also been supporting the set-up and initial running of a youth council at the Queen Elizabeth Hospital in Kings Lynn. This aims to give those aged 16 to 25 a voice within the hospital around the issues that are important to them, and also help to shape the new hospital building and its services, which are planned for West Norfolk. The first members are in place, with more to be added in the months ahead. The work doesn't stop there. Our projects around digital access to care and the experiences of carers of those with serious mental illness, or SMI, will continue. We also recently published a report around what patients thought was needed at the Community Diagnostics Centre at the James Paget University Hospital in Galston. This has already resulted in some changes, including improved signing and the introduction of a volunteer scheme to help people navigate their way around the building.
Meanwhile, project work continues around the Maternity Voices partnerships in Norfolk, the experiences of those who are deaf or hard of hearing at their GP practice, and mail fails, that's badly worded or explained letters or emails from health and care providers. Over the next 12 months, we also plan to revamp our online feedback centre to make it simpler and easier for people to share their experiences with us. And we're also bringing in a new service which makes it easier for people to leave feedback using BSL, or British Sign Language. So a wide range of work and projects, but all playing a part in ensuring we can tell those making key decisions about health and care what's important, and helping to put more pieces of that jigsaw puzzle of support together.